Felt like Adena had a lot to offer, where it was a balance between a community rural hospital but still very educational driven.
So I have personal and academic reasons for choosing Adena. Personally, I have family that lives here. I'm from here, so that was an easy choice for me to be close to home. And I think it's also pretty unique to be able to serve in the community that I grew up in.
We have a formal mission statement on our website, but for the most part, I'll paraphrase it. We are here to provide culturally sensitive and very highly appropriate, safe, efficient, effective, patient-centered, equitable, and timely care to the community that we serve.
I think the biggest thing that has impressed me about the residency program here are the residents themselves, that they are truly a team. They always have each other's backs. They take care of one another, they help one another, they guide and teach one another. And having been in practice for 33 years, what really builds a successful team is when everybody works together.
No matter what your interests are, this program tailors to what you're interested in, whether it be sports medicine, procedures, etc., hospital medicine. We have different things here that can tailor to your interests. It's a very welcoming environment, supportive, great place to learn, and in a stress-free environment. It's non-competitive, just a very welcoming place to come.
So I wanted to stay in Ohio, first of all, because Ohio has just always felt like home to me. I really feel like there's a lot of diversity and culture here, but I want to stay close to Central Ohio, but I didn't want to get lost in a big city or university hospital.
I guess something that I discovered in the community that I didn't expect was how close the community is, how supportive they are of one another, and I guess just the support, I think, is the biggest thing that I've seen.
Yeah, I think this is a great place to work and learn because we see a lot of really interesting things. It's a rural area, so we get to see a lot of pathology here that maybe you wouldn't see on initial presentation at a university hospital or something like that. We get to make that initial diagnosis oftentimes, which is not something you can do everywhere. So we see a lot of unique things coming from the community here.
We get a pretty good schedule. We're done at a decent time, so we're able to go home and spend time with, I live with my girlfriend, and we were able to cook together. We still have time to go out to workouts, and we get together with the residents pretty frequently too, so there's lots of social things going on.
It's really a nice schedule as a third year. It's really more of an 8 to 5 sort of thing, and then once I get off work, I get to go home and spend time with my husband and my kids and live a normal-ish life.
They pretty much get to do anything that they want to do based on their comfort level in the room. So they can do the entire exam all hands-on, or we can do it together. So it's really whatever they want to make of the program. If they're really interested in doing pediatrics, there's so much hands-on opportunities in our office.
Our residents are comfortable practicing in any environment, whether it's a big city, a small town that you can't even remember the name of, or a medium-sized city in a teaching program. We've graduated residents from all of those.
To me, the PACR Medical Education Center is a fantastic learning environment. We have simulation labs that we can practice any type of procedures that we want. But I think the most important reason why I came here was the people. The people are very kind, compassionate, anywhere from staff, preceptors, attendings, and all of the residents are just very supportive. You should come to Adena.